Hello, everybody, and I hope you had a great Thanksgiving week. Um, we haven't really touched base aside from emails that I get from people since, what was it, beginning of week 12. So we had about 2 weeks to cover the last chapter of material, and now we are into week 14. And we're going to be covering chapter 12, which is psychological disorders. Next week, we'll cover treatment for psychological disorders. And I really want to just say that these two chapters, 12 and then 13, really piggyback off one another. So as you're learning about the different disorders, what they are, what the symptoms are, you're going to want to keep that fresh in your head for then when you get into chapter 13, you're going to revisit every one of those disorders, and then the chapter is going to discuss what can be done for them. So what would treatment or therapy look like? So it's really good to just, don't get too far removed from this chapter once you finish it. It's not sort of a standalone chapter, but it's very interconnected to then the treatment chapter in chapter 13. So, good to preface that. Here's your to-do list for the week. In terms of this chapter, what are you going to be learning about? First part of the chapter, you're going to take a look at just mental illness in general. How was it treated and explained in the past, and then how do we see it today? How do we even identify what a psychological disorder is? What's the guide that we follow? How do we know what's a disorder? What makes something a disorder, I guess you could say. And then a little bit about the stats for each sort of classification or class of disorder. What's the prevalence? Like, how many people in, say, the US have it? How often do we see it? And how severe maybe are certain disorders in terms of treatment or being able to seek out care and seek out help for it. So we're going to spend a good portion of the beginning of the chapter covering just the general necessities of mental illness before then we start getting into different classes of illness. And these classes follow suit with the APA manual, which is the Diagnostic and Statistical Manual for Mental Illness, the DSM. And it basically classifies and organizes disorders according to, symptomology and onset, severity, and so forth. So the first class of disorders that we're going to be looking at are anxiety-related disorders. Anxiety disorders is the umbrella class. What are the symptoms? And then specifics. So types of anxiety disorders would cover OCD, obsessive compulsive disorder, stress-related disorders, panic disorders, generalized anxiety disorders. So you're going to come to understand the slight nuances of each one of those. How are they unique, even though they're each in the same class? How do we differentiate between each specific one? We'll also take a look at what might be some of the triggers or the causes of anxiety and trauma, as well as stress-related disorders and sexual dysfunctions, which often fall under this classification. So a good deal of time spent on anxiety until we then move into dissociative disorders, previously known as multiple personality disorder, spend a little bit of time there, and then jump into a major category, which is depressive disorders or disorders of the mood. And these, again, include a range. Depression is such a broad category. It can go from very mild dysthymic depression to major depressive disorder. And then bipolar disorder, which fluctuates or cycles through periods of mania and periods of depression. So we'll talk a little bit about bipolar disorder. You're going to be looking at different viewpoints of how psychologists approach mental illness. So you're going to be introduced to behavioral, social cognitive, and biological explanations specifically for mood disorders, because these are the three main categories that help us to gain an understanding of the origins of mood disorder, as well as how to approach treatment for it. Then we'll move into talking about eating disorders, the various types, and how culture plays a really strong role in eating disorders. Eating disorders are not unique to our culture, but absolutely more prevalent in North America. And there's certain continents on our lovely planet that really see very little in the way of eating disorder. So why is that? How is that affected by cultural factors? We'll look again at types of sexual dysfunction, which piggybacks a little bit from up here as well, because it is linked to anxiety, but we'll take a look more specifically at how that develops before then getting into another key area, which is schizophrenia. Schizophrenia is a very complex mental illness, lots of variables, genetic and environmental, and so we'll take a look at those. And then lastly, we'll end with personality disorders. And personality disorders is a very broad, huge range of various disorders, and many of which overlap, and many of which are comorbid with mood disorders or anxiety disorders. It's often the case that somebody who has an anxiety disorder doesn't just have an anxiety disorder. They may also be depressed. They may also have schizophrenia. They may also have PTSD. So we often see what's called a high comorbidity between mental illnesses, which just makes it difficult to treat, difficult to parse out symptoms and know how to treat effectively each of those, so that the person has a good quality of life. And then the chapter ends with a little bit of things that might hit home more so for you all, identifying ways to overcome test anxiety, some little tips and tricks and techniques. Okay, so here's your lecture slides. The videos you're going to be watching this week, now this is super important, you'll want to pay attention to. You're going to be watching the first two episodes the first two videos in episode 17. Episode 17, again, combines psychological disorders and therapy, which the book divides into two chapters. So you're only going to be watching the first two, which cover psychological disorders. And that's not very many. So I've supplemented this week with a few others that are my favorites that I like, are good, so you can get a good variety of what you're seeing. So those two in episode 17, and then I also have posted a video about OCD, looking at a guy named Chad, and then also looking at Howie Mandel, both with OCD, different types of OCD. So you'll get a chance to see kind of how the anxiety manifests on an obsession with different things. For Chad, he really has a lot of anxiety with going outside and hand washing a little bit, counting, whereas for Howie, it's really about germs and about things that are dirty. So there's where the obsessions are, and then you'll see the compulsion end of it and how they engage in various ritualistic activities to sort of rid themselves of the obsessions that they're having and the anxiety that causes. I've also included a video clip of Disorganized Schizophrenia. It's just a clip from the movie The Soloist with Jamie Foxx, great movie, and Robert Downey Jr. Jamie Foxx plays a guy who has disorganized schizophrenia, and you'll get to see a little bit of that. There's so many great movies. And in fact, in the last week of classes, I'm going to offer a little extra credit for watching a movie of your choosing on mental illness. So there's a lot of great ones. A Beautiful Mind is another one that comes to mind. And that is of someone who has paranoia schizophrenia, and that's the famous story of John Nash. So that's a great one too. If you're in the mood for a movie this week and kind of want to get a better gauge of what someone with schizophrenia looks like, look for A Beautiful Mind. I don't know if it's on Amazon, but you could probably find it. And then this week's discussion is talking about depression. Specifically, the Hawk reading deals with trying to get at some of the origins of depression, and many studies have seen the links between depression and learned helplessness. So you're going to be looking at the amount of control one has in his or her life is often a factor that contributes to one's, predisposition to depression and how they cope with their life circumstances. When control is little, it is hard to dictate where your life's going to go. Depression is more likely to happen. So it's really connected to emotional well-being. But, it's work by Seligman and Meyer, and it helps us to understand the etiology a little bit of depression. I mean, sure, some is biological, and we see that in the book. But a lot of it is environment and stresses placed on us by the environment. So in this discussion post, I also want you going back to a little bit of the content that you learned in Chapter 9, which dealt with health and stress. And I want you to put yourselves in the position of a psychologist. You have a client who's suffering from depression. What would be some good coping strategies that the client can use? So integrate what you learned from this reading on depression and the etiology of it and what Seligman and Myers said they found in terms of helplessness and control and its links to depression, and integrate that into what you learned in Chapter 9 about stress and health and coping. What could you suggest to a client that might help them? And this is causing you to think ahead a little bit, because next week when we get in to the next chapter, Chapter 13, we'll be covering treatment for things like depression. So then you'll really get a sense of, what are people doing in the clinical world to help this problem. Lastly is the quiz this week, as usual, and that will close on Friday the 7th. So that wraps it up. If you have any questions, please feel free to email me this week. Otherwise, have a great week, everyone.